Hello friends, I am Rashmi. Welcome to SRS Info. Today we will discuss about the concept of prevention of diseases. In the last class we discussed about the causative agents like disease agents, then host and environment, and how does the interaction of these complex factors resulting in making a person a patient. Okay, so today we will discuss about how we can prevent the occurrence of diseases. Basically, medicines play a very important role in the prevention of diseases. How medicine helps to promote the health, preserve the health, and restore the health. Okay, we cannot imagine a life without medicines nowadays. That much important role is played by medicines in our life. So what do medicines do? Medicines helps to promote the health and preserve the health, maintain our body as healthy. Okay, preserve the health, then restore the health. In the disease condition, we may deteriorate the health. Okay, but taking the medicines, we can restore our health back. So these are the important roles of medicines by which we can prevent the occurrence of diseases. Prevention of a disease includes all these three goals. Okay, so prevention means we have to promote the health, we have to preserve health, and we have to restore health. These are the main goals, and these goals are achieved by the use of medicines. Clear? So, in relation to the natural history of diseases, I have explained in detail about the natural history of diseases in the last classes. What is natural history? The occurrence from the pre-pathogenesis to pathogenesis phase. This is the natural history of diseases. In this natural history, there are three levels of prevention are identified, are classified. They are the primary prevention, secondary prevention, and tertiary prevention. So these are the levels of prevention of diseases. So let us discuss these levels of prevention in detail. The first one is primary prevention. What is it? Primary prevention is the action taken prior to the onset of disease. That means it occurs during pre-pathogenesis phase. What is pre-pathogenesis? It is the phase before the onset of disease in our body. This is the pre-pathogenesis. The pathogens are not work well, not start to active. That is the phase of pre-pathogenesis. And primary prevention should be taken prior to the onset of disease. Okay, and what are the interventions of this primary prevention? The first one, if we really need that we should not be diseased, so what we have to do? We have to maintain and promote our health. The first one is we have to keep our body and mind healthy, and we have to promote the healthy lifestyle. Clear? So this is a primary preventive intervention. Clear? The second one is specific protection. For example, vaccination. For a specific purpose or by a specific method, we can prevent the occurrence of disease. Like vaccination. Vaccination reduces the intensity or severeness of a disease. Clear? So in the pandemic situations now, why the government is taking that much of initiative to vaccinate the people as much as possible? Because vaccination reduces the intensity or severeness of disease. One point is this. Some other examples like taking non-contaminated or pure or good quality of food and good quality of water, good lifestyles, hygienic lifestyles. These are the specific type of protections by which we can control our life, our body, our mind from occurring disease. Clear? So this is the primary prevention. I hope you understand it very well. The interventions means what are the specific methods by which we can control or by which we can achieve the goals of the prevention of the disease. Clear? So this is the primary prevention prior to the onset of disease. The next one is secondary prevention. Secondary prevention is the action taken at the early stage of a disease. Even after we are taking care of ourselves, sometimes we get diseased. Okay, so in that condition, the action or the preventive measures we are taking at the early stages of disease is called secondary prevention. And why the secondary prevention is important? Secondary prevention halt the progress of a disease. Clear? Okay, the disease occurred, but the secondary preventive measures halt or reduces the progression of a disease, and it helps to prevent the complications of disease. What are the major complications or outcomes of diseases? We also discussed this topic earlier. What are the outcomes? It may help to recover the health, or it may cause the disability like partial disability or complete disability, or the last one is death. These are the major outcomes of disease. Clear? So secondary preventive measures help to prevent the complications of diseases like disability and death. Clear? And it will help to recover the health. And what are the mode of intervention of secondary prevention? The first one is, okay, we are undergoing the disease conditions, but it is very essential to diagnose the disease. What is the disease condition? Okay, and according to the diagnosis, the treatment is also very important. So these are the most important mode of intervention of secondary prevention, that is early diagnosis and treatment, because this action is taken at the early stages of disease so that we can control the progression and prevent the complication of diseases. Secondary prevention arrests the progress of disease and restore health and prevent the irreversible damage. What is irreversible damage? That is disability, partial or complete disability, and death. These are the irreversible damage. So by using the secondary preventive measures, we can prevent this irreversible damage. And most important point is that secondary preventive measures protect other members of the community from acquiring the disease. We are living in such a pandemic situation, so there is no need to take any other examples. By protecting ourselves, by isolating the patient, we can protect the patient himself and the community from spreading the disease to them. Clear? So these are the main goal or main objective of secondary prevention. It is very essential to diagnose the disease and take the proper treatment at proper time and taking proper medicines. Clear? So in the community pharmacy and the community healthcare sector, secondary prevention plays a very, very important role. The third and last one is tertiary prevention. Okay, the first one was prior to occur the disease, before the onset of disease, and the secondary preventive measures after occurring the disease, but it was in the early stage. But in the case of tertiary prevention, this action is taken after the disease has advanced, okay, and beyond the early stage. It has already advanced. There is no further scope of recovering the health. But yes, there is a possibility to sustain or maintain the health and supporting the patient even after they are partially or completely disabled. In such cases, the intervention is by disability limitation. Okay, the patient is under coma or is under paralytic conditions, but we can support the patient mentally or physically as long as he lives. Okay, and rehabilitation. The most important thing is, in the tertiary cases, we need a rehabilitation support, like for reducing the pain and give mental and physical support for the patients. We need a rehabilitative care. And these measures minimize the sufferings and help the patient to adjust with the derangement of health. Derangement means in the tertiary situation, there is no scope of recovery of health. Okay, but what happens in that case is that there is a deterioration of health happens. But even in such condition, it's very essential to the patient to adjust with this situation. So for that, the medical professionalist and the community people can support this patient, can give proper mental and physical support to minimize the sufferings and pain of that patient. Clear? So tertiary prevention is a rehabilitative measures. So the intervention is by disability limitation and rehabilitation. So this was the levels of prevention of diseases. Okay, first primary, secondary and tertiary. And we discussed about some interventions also. Like for the primary prevention, the health promotion and specific protection. For the secondary prevention, early diagnosis and treatment. And in the tertiary prevention, disability limitation and rehabilitation. Clear? So these are the modes of intervention. In the next class, we will discuss in detail about these modes of intervention. Okay? I hope you enjoyed this video. Thank you.